Hello, my name is Kamri Robinson. I'm giving the first part of the speech for Group 4. It's a persuasive speech at Lamar University for Public Speaking 1301, and it's going to be over healthcare. According to the CNN News, out of more than 3 million citizens living in the United States, nearly 35.4% of those people were on some sort of governmental assistance, mostly related to welfare. In the United States, results from the 2007 survey on drugs and health showed that 19.9% of Americans, 19.9 million Americans, or 8% of the population aged 12 years or older, are using illegal drugs at least a month before the survey was given. With a growing number of citizens who are on welfare, it is important to maintain giving assistance to those who need it rather than those who are simply looking for free help. The purpose of this wonderful establishment is to support those who can no longer support themselves and their families. It is not to support those who are too lazy to work and too addicted to drugs to function. During the 1930s, there were many changes that were rocking our great nation to create what we know today as America. By 1935, a national welfare system had been established in American history. It was the very first step. The primary concern for this establishment was to take care of the citizens who were enduring hard times and could no longer support themselves or their families, in hopes that eventually, in a small amount of time, they would be able to assume their roles and positions within society, working towards the greater good. This simple public service was originally created with the purpose to help. However, as the country has developed in every direction, including the wrong way, we have certain loopholes that are no longer beneficial for our society and its well-being. According to the U.S. Census Bureau, out of 12 million single parents in 2014, more than 80% of them were headed by single mothers. In today's society, 1 in 4 children under the age of 18, which is approximately 17.4%, are being raised with a single mother, and 45% of those children are below the line of poverty. For those living with a father only 21% of them are under poverty. And considering when you have mother and both father, only 15% are below poverty. With that averages of having about 2.5 children per household, and those percentages of single parents and struggling parents, it is not hard to understand why this assistance is needed. However, with the requirements and regulations limiting society, as lenient as it is, we have people who are simply riding the system looking for free advantages. This assistance was not set up for those people. We are always trying to work towards the greater good of our society as a whole. Providing free health care as well as food and housing for those who wish to spend their time participating in illegal activities such as drugs is not the goal that we are searching for. Supporting those citizens does not work for the greater good of our society. By implementing an easy drug testing system requiring the recipients who accept the assistance to pass, we are essentially stopping many of the unwanted loopholes of the welfare system. When I looked up the goals for it, 68.2% of Americans approved of a mandatory drug testing system. Requiring a quarterly drug test will make sure that those who are receiving assistance are not receiving a free ride. This action will also allow other citizens who are working hard to ensure that the promises of America will become established will know that they are no longer supporting the deadbeats, drug users, and in return they are becoming more confident as a society together, and we can work better towards each other. The next speech will be given by Sarah.